Hello, thank you for coming today. My name is Megan Bradburn and I will be interviewing you today.
Hi, I'm Kalic. It's nice to meet you.
I'm just going to start by asking you the first question. Considering the NMBA standards for practice that govern your nursing practice, how will you deal with the following scenario? It is your first rotation as a new graduate nurse and your patient who needs to remain in bed is agitated and demanding to go for a cigarette. The patient stated that they are not satisfied with your care. How would you handle this situation? Reflect on how you would handle the stress of the job.
Experience from my recent occupation as an assistant in nursing has definitely taught me ways to de-escalate situations and how to deal with agitated patients. I've definitely learned that each and every individual will react differently in a situation and no two patients are the same. Before approaching any situation with regards to an agitated patient, I always ensure the safety of myself, the safety of the patient, and the safety around staff and just all other patients, around the same area. I understand the importance of a therapeutic relationship, and in my experience with situations like these, the patient just wants to be heard. In this particular scenario, I would de-escalate the situation by reassuring my patient and by using quite a calm but assertive tone. Just ask him what was it in particular that made you unsatisfied with my care. So I would take the time to sit with my patient and let him know that I'm actively listening and I'm taking the time to understand his wants and his feelings. So once identifying the concern in this situation, it's the patient wanting a cigarette, I would just explain to him the reasoning behind why, maybe he's not allowed to go outside to have a cigarette in this moment. And I would just offer him some choices and, other options and just provide him with some optimism. So for example, in this situation, I would just say, I'm sorry, sir, at the moment, you're under close observation, your obs have been a bit unstable, and at this very moment, it would be unsafe for you to leave the ward and to go outside. As a nurse, it's my duty of care to make sure that you're safe, and at this moment, I just don't feel safe, allowing you to go outside for a cigarette. But once your obs are within good limits and the doctors are happy to let you go outside, I'm more than happy to assist you with going outside and for you to have a cigarette. How does that sound? And if I'm unsuccessful in de-escalating the situation, I'll seek support from my team leaders, from the NAM. And if the situation does progress and escalates, then, security is always an option if the patient becomes aggressive or if it becomes an unsafe environment for myself and for my staff members. Once the situation has resolved, I would definitely debrief with my staff members and with the team leaders and, just assess, in future, if this does happen again, what can be done better and what did we do well. I would definitely touch on the importance of having a therapeutic relationship with your patient. Obviously in this scenario, that therapeutic relationship wasn't there, and as the patient stated, he was unsatisfied with my care. So I think having that therapeutic relationship with your patients in future, always introducing yourself, asking them, is there anything I can do for you, and maybe in this situation, if the patient had that therapeutic relationship there, it wouldn't have escalated, and I would have just been able to sit down with my patient and explain to him, why at this certain time he wasn't able to have that cigarette. In general, I understand the stressful environment that comes with nursing, and some coping strategies that I would use, on a shift-to-shift basis would be utilizing shift planners. As an assistant in nursing, I use these and I found them really, really helpful. I think it just helps to, ensure that you're getting all tasks done. And when you can actually see it in front of you and, you can allocate yourself enough time to get things done and, build those therapeutic relationships with your clients, because you can see, oh, I've got a half-hour time slot here, or, I'm quite busy at this time. And it might just allow you to sit down with your patients and have that time to build that therapeutic relationship. Another coping strategy I would use is just remembering that a patient's frustration isn't always geared at an individual nurse, and sometimes patients may be frustrated because they're concerned about their health, or they're in the environment of a ward where they're feeling constricted because they can't do their usual things that they do at home. So I think, just remembering that it's not personal, and, patients may have their concerns, but, just working with them to, ensure that they're not feeling constricted and they're feeling, I guess, at home. Although it's a ward, you want to make them feel just as comfortable as they can. And I think, just remembering that it's not personal when they are agitated, and just to kind of take it in and think, how can I de-escalate this? How can I build that therapeutic relationship? Another coping strategy that I would use in the stressful environment of nursing would be debriefing. In my experience as a student nurse, I always found it really helpful at the end of every week or at the end of every shift, debriefing with my facilitator, and just sitting down and acknowledging what my strengths are and what my weaknesses are. And I think in this scenario, it would definitely help identify, in future we could do this better, but what we did do well was this. And I think that really just helps to break scenarios apart and look at a kind of step-to-step way, and seeing, okay, in future, this is what we can do to improve the way that we handle the situation.
Okay, and now the second question is, nurses have to comply with occupational health and safety standards. Describe a time you had to deal with an unsafe situation and how you handled that.
During my employment, on quite a regular basis, actually, I was asked to transfer patients on my own when they were actually to assist. A scenario that I remember particularly was during a shift, a registered nurse asked me to transfer her patient from her bedside to her bathroom. And before introducing myself to the patient, I just had a quick look at her handover sheet, and I flicked through her notes, and I identified that she was actually a to assist, and she needed a 4-wheel walker and a pelican bolt to transfer from her bedside to the bathroom. So in this scenario, I just approached the registered nurse and I said, do you mind giving me a hand? I don't feel safe transferring this lady on my own, as I've identified that she's a to assist. The nurse went to tell me that I've transferred this patient many times. She's good on her feet. She won't fall. According to, I think it's standard 6 of the NNBA standards, the nurse provides comprehensive, safe, quality practice to achieve agreed goals and outcomes that are responsive to the nursing team needs of people. In this situation, I didn't feel as though this nurse was providing safe, quality practice. I remembered previous research that I had conducted on occupational health and safety, and I remembered how to identify and how to report an unsafe situation. So I approached the team leader at the time, and I just told her about the situation, in a real assertive and friendly tone. I just explained to her, I've been asked to do this task and I don't feel like it's safe to do on my own, and I personally don't feel comfortable doing it on my own. The team leader directed me and just said, there's another AIN on the ward. She's currently busy, but when she's ready, maybe just ask her for some help. I then went to my patient and I introduced myself. I just told the patient that, I'm just waiting on another nurse's help. It's not safe for me at the moment to transfer you on my own, and it'll just be a minute. And I just gave her the buzzer and I told her, in the meantime, while you're waiting, if you do have any concerns or if you do need some help, just give me a buzz and I'm happy to come help you. I then communicated with the registered nurse that initially asked me to transfer this patient for her. I just explained to her that I have not yet transferred the patient and I'm just waiting on some help from the other assistant in nursing, and that I just communicated with the team leader that I had some concerns doing the task on my own. By following occupational health and safety standards, I was able to ensure a safe outcome for my patient. The clinical examples that I have provided reveal my potential to work with the occupational health and safety standards, and reflecting on this unsafe situation, I know that I effectively communicated within my team and I worked competently within my scope of practice to deliver this best and most safest care to my patient.
Good. Now the third and final question is, the completion of your bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you there is a lifelong of learning and autonomy. After obtaining employment, What is your long-term career plan or commitment to professional development?
Formulating a career plan is definitely an important aspect of becoming a professional nurse. During many of my clinical placements in the past, I have actually attended personal development sessions, which have helped me definitely further expand on my knowledge around specific equipment, OH&F procedures, and quality care. During my placement at Westmead Hospital in the cardiothoracic step-down ward, I attended an in-service on vacuum-assisted closure therapy, which enabled me to expand on my skills around vac dressings and, definitely built on my confidence regarding the equipment that's used, sterile procedures and, why we actually use vac dressing. As part of my long-term career plan, I plan to continually expand on my knowledge and skills to deliver high quality, safe and effective care to my patients. To keep up to date with the pace of healthcare development by attending in-services. I understand the importance of completing 20 hours of CPD yearly and how this aids nurses in keeping up to date with their training to deliver high quality care to their patients. Another way that I will commit to professional development and learning is actively seeking feedback from my facilitators and educators, just giving me the opportunity to reassess my skills and identify my strengths and weaknesses. I often utilize my knowledge of the Gibbs reflective cycle. It just helps me to identify what could be done better in the future and what was done well in a scenario. So valuing and engaging in debriefing with team members at the end of every shift is another way that I plan to commit to continual professional development. Just using what you gather from debriefing to create an action plan and incorporate improvement into future performance.
This concludes our interview for today. Thank you for coming in and good luck with your application process, Tia.